Hi, I'm Bruce Jugan, president of BenefitsCafe.com. We specialize in health insurance. This video is for people who buy their own health insurance and don't get it from their job. I'll explain changes due to the new healthcare reform law called the Affordable Care Act, or the ACA. The information here is current as of August 26, 2013. The most significant changes of the Affordable Care Act begin January 1, 2014. Starting then, everyone must buy a health insurance plan or pay a fine. The penalty is intended to encourage people to buy coverage. When you prepare your taxes, you'll need to report where you get your health insurance coverage. Do you get it from work or do you buy it on your own? If you haven't had any coverage for more than 3 months, you'll need to pay the tax man when you send in your annual return. Let's look at how the penalty will work. You estimate the tax penalty in 2 ways and use the one that results in a larger fine. You calculate it either as a flat dollar amount for each person in the family, or you apply a percentage of income above the tax filing threshold. This slide shows a penalty for a family of 4. Their household income is $70,000 per year. In 2014, a family of 4 that earns less than $29,000 will not pay any taxes. So in this example, we take $70,000 minus $29,000, which is $41,000. The flat dollar amount penalty in 2014 is $95 per adult and half that per child, or $285 for this 4-person family. As a percent of income, the penalty will be 1%, or $410, which would apply because it is the larger amount. In 2015, the penalty increases to $325 per adult and half that per child, totaling $975 for this family. The percentage of income penalty doubles to 2% and would be $820 for this family. The per-person penalty of $975 would apply because it is the larger of the two. In 2016, the penalty increases to $695 per adult and half that per child, or $2,085. This is more than a 7-fold increase in the penalty compared to 2014. The percent of income penalty increases to 2.5%, or $1,025 for this family. The larger per-person penalty applies. While the penalty may currently be less than the cost of health insurance, keep in mind that people must pay this penalty, plus they must pay all of their medical expenses because they still would not have any health insurance. Beginning 1/1/14, insurance companies must accept everyone who applies during the open enrollment period. The open enrollment period prevents people from waiting to apply until they are sick or injured. The first open enrollment period begins October 1st, 2013 and continues until March 31st, 2014. That's 6 full months, plenty of time for everyone to enroll. Subsequent open enrollment periods are much shorter, just 7.5 weeks, October 15th through December 7th. People who don't enroll during this period won't be able to get coverage unless they lose their coverage for some reason beyond their control. If you get your insurance through your work and it stops for some reason, like you quit your job, you'll be able to enroll as a special enrollee as long as you enroll within 60 days of losing your other coverage. Remember, this open enrollment period only applies to people who do not get their health insurance through their work. Every job-based plan has its own open enrollment period. The ACA requires that all health insurance plans sold to individuals and small businesses must have comprehensive benefits. Benefits that are much better than plans currently available in the individual market. Let's look at some of the specific plans that will be offered in 2014. This slide shows 4 of the standard plans that insurance companies will offer in 2014 to individuals and families in California's exchange. The plans are ranked in order of least expensive and lowest benefit. On the left, the bronze level plan with a $5,000 deductible that includes medical and pharmacy expenses. Next is a silver level plan that has a $2,000 calendar year deductible and pays 80% of doctor and hospital expenses. The gold level plan has no deductible and low copayments for doctor and hospital services. Finally, the best plan is the platinum level plan with 0 deductible and low copayments for doctor office visits, prescription medicine, and hospitalization. These plans have very comprehensive coverage and don't seem to have any loopholes. Health insurance is like a balloon. You push it in one place and it bulges out someplace else. As of today, August 26, 2013, the insurance companies have not released the rates for their 2014 plans. Most people expect the plans to cost more than current because the new individual and family plans will have better benefits, rates that will be based on fewer variables, and more people with pre-existing medical conditions will be covered with no additional surcharge. Covered California is the name for the exchange in California, and they have released a few rates. Here you can see their rates for a 40-year-old in much of Los Angeles County. The rates range from $196 per month for a bronze level plan from LA Care, a company that has historically offered Medi-Cal or health care for low-income people, to $420 per month for a platinum level plan from Kaiser Permanente. Anthem, Blue Shield, HealthNet, Kaiser, LA Care, and Molina Healthcare will offer plans in this exchange. If you're not exactly sure of the difference between an HMO and a PPO, watch the video on benefitscafe.com and check out the chart on our website that explains the difference. To lower the cost of health insurance, the government will give low and middle income people subsidies, but you can only get the subsidy if you apply through the government system called Covered California. Here's how the subsidies will work. They will apply to the silver level plan. This table shows that people who earn roughly $16,000 to $17,000 per year, which is about $8 per hour for somebody working full time, that person will pay only $19 to $57 per month for their health insurance. In addition to paying a low monthly amount to the insurance company, low-income people also pay less to doctors and hospitals when they use medical care. For example, people in the lowest income category pay no deductible. The next highest income level will have a $500 deductible and slightly higher charges for doctor and hospital expenses. As people earn more money, their subsidy declines. If you think that you might qualify for a subsidy, give us a call at benefitscafe.com and we can help you enroll with Covered California. Covered California is the name of the exchange in California. The federal government will invest $900 million into Covered California to market and enroll people. Licensed agents such as benefitscafe.com will be able to enroll you in Covered California. Covered California is not an insurance company. Rather, it contracts with the insurance companies we saw in the previous slide, and they provide the insurance. Covered California helps them enroll people. Many insurance companies, including the ones you see here, will offer similar health insurance plans off of the exchange. You should have more options off of the exchange, and the process will likely be easier. If you don't qualify for a subsidy because you earn too much money, then you'll likely want to apply for an off-exchange individual health insurance plan. BenefitsCafe.com can help you enroll off and on the exchange. If you've had your individual and family coverage since March 23, 2010, and you haven't changed plans, then your plan should be considered grandfathered. In this case, you will be able to keep your current plan and not change over to one of the new plans. This may be very valuable. We won't know exactly how valuable your current plan is until we see the 2014 rates and benefits. It may be in your best interest to keep your current plan, which may save you money. If we are your agent, give us a call at 800-746-0045 and we can help you figure out the best course of action. For more information, watch the other videos and read the many articles on benefitscafe.com. We'll help our clients figure out the new system. Give us a call if you'd like to work with us. Thanks.